Hey everyone, Dr. Taylor Levine here at Schlick Art Studios, where today I'm going to be going over some exercises that you can be doing at home or at the gym. So let's get started. Okay, so for the next set of exercises that I'm going to be going over, it's going to be really great if you are dealing with low back pain. If you have generalized low back pain, if you're getting sciatica, if you're getting numbness and tingling down the legs, these exercises are really going to help work on strengthening your core and your upper glute muscles to help give you that low back the stability that it needs. So this next exercise that we're going to do is going to be really great for individuals that are dealing with sciatic pain. And what I mean by sciatic pain is pain or numbness or achiness or tingling going down this leg. It's going to help with trying to mobilize and get that sciatic nerve moving a little bit better, which will hopefully reduce some of the discomfort that you're dealing with the leg. We are going to be doing both sides, regardless if you have only the sciatic pain on your right side versus your left side or vice versa. So what we're going to do is we're going to first start on our back. And while laying on our back here, again, just like in my previous videos, you want to make sure that your pelvis is tilted back so your back is completely flat on the ground and your core is engaged. At this point, we're going to start with my right leg. So our left leg is going to still stay in this bent position here like this. And what we're going to do is we're going to take our hands and put them right behind our knee, holding our leg up. From this position here, we're going to take our toes, and bring them right towards our face and holding this position and then bringing our leg up. At this point, you'll start to feel some tension in that sciatic nerve. Where you feel that tension, you'll kind of back down a little bit, and then you'll start bringing your toe up to the sky and back down to the face, up to the sky and back down to the face. And doing that, you can do this in 3 sets of 10 while what we call flossing the sciatic nerve. Now, in between sets, you will probably notice that you'll be able to bring that leg up a little bit higher because we're getting hopefully that mobility that we're looking for. So again, you're going to then bring that leg up. You're going to put your hands behind that knee area. And with your leg at 90 degrees here, you're going to bring your toes to your face, and then you're going to bring that leg up, and then you're going to retract down a little bit and point to the ceiling, and then go down to the face, doing this 10 times. And then again, make sure that we do whatever we do on the right side, we do on the left side, so that we're equally getting that sciatic nerve to mobilize and move. So if you have any questions or concerns about any of these exercises that we just went over today, come on into my office and we can talk about any of the forms or procedures on how to do them. My name is Dr. Taylor Levine from Unruh Spine Center, and we'll talk again soon.